Hello everyone, I'm Kana Taku. Ever since post-traumatic growth or PTG was introduced in the 1990s, researchers and practitioners have been trying to see how we can apply this concept into clinical settings. There are many reports already, but the majority of studies simply used the PTG inventory as an additional tool to evaluate the effectiveness of their existing programs or therapies. But there are some researchers who have created entirely new programs that are trying to integrate or apply PTG instead of just adding the inventory as part of their work. So I'm going to talk about 3 of them today. Number 1, this is called Second Story. It is run by Dr. Anne-Marie Rovka and her colleagues. It is a group format psychosocial intervention that was developed to foster PTG. They integrated the 4 areas of research into their second story, which are positive psychology, future-directed thinking, meaning-making, and narrative therapy. Their session lasts 6 hours in a single visit, but then 1 hour additional booster session was also offered 2 weeks later. Their second story did not use a psychoeducational approach. In fact, they said the term PTG appeared nowhere in their intervention materials or protocol, so definitely no quick manipulation at all. It is hands-on and allows participants come to their own realizations about their personal growth after participating in the one-day program. They did a pre-test to understand the participants' baseline, then collected data right after the program, 2 weeks later, 4 weeks later, and 6 weeks later. Their participants were, by the way, people who had lost a loved one within the past 3 months to 5 years. They also tested the effectiveness of their program by using a randomized controlled trial with the participants completing a 30-minute expressing writing therapies. So their research design is really rigorous, and I admire that. Now we come to the results. Of course, researchers were hoping to see that the second story participants would experience greater improvements in PTG. Well, the results did not show exactly the way they were hoping. PTG got higher immediately after the programs, but for both groups. But there were also no significant changes from that point to the follow-up. Well, no need to get disappointed because participants in both second story and expressive writing groups experienced a significant decrease in PTSD symptoms. So I really want to emphasize that there is no bad news here. Number 2, our lab. We developed a brief PTG psychoeducational program for teenagers. We compared 3 groups by randomly assigning 1/3 of the high school students in the PTG psychoeducational program, 1/3 for the PTSD psychoeducational program, and the rest in the control group who discussed psychology in general. There was a pre-test and a follow-up test 3 weeks later. As for the results, again, no need to get discouraged, but there were no significant differences between those in the PTG group and those in the control group. But interestingly, those who participated in a PTSD group actually reported a decreased PTG at the follow-up. This means that getting an opportunity to reflect on, learn about, and discuss the negative impacts of trauma in regards to PTSD suppressed PTG. But on the other hand, getting an opportunity to reflect on, learn about, and discuss the potential positive impacts of trauma in regards to PTG did not increase their own sense of PTG. This could be due to an internalized expectations that trauma should produce negative outcomes that is consistent with our stereotype or beliefs anyway, so only talking about negative aspects and how to cope with them seem to suppress PTG. But of course, we originally wanted to show what could foster PTG, and we couldn't find any. So that's that. Number 3. This is a good one. It's called the Boulder Crest Institute for Post-Traumatic Growth, or Warrior Path program. PATH is an acronym, and it stands for P as progressive, A as alternative, T as training, and HH as healing heroes. So PATH. It's based on the PTG theory and is designed to ensure that combat veterans, first responders, and their families can live great lives in the aftermath of trauma. The director of the Border Crest Institute, Richard Tedeschi and Brett Moore, recently published their reports. And here's what we have good news. Their results showed an increase of PTG in their pre- and post-test for long-term effect during an 18-month follow-up. Not just PTG, resilience, self-compassion, and psychological flexibility all showed a significant increase between pre- and post-test. PTSD symptoms, depression, anxiety, and stress all showed a significant decrease. So it's really successful. But the only small issue is that they didn't have a control group. So it's a little bit harder to conclude whether there is a true effect. It's still definitely promising though. But recently, I published a book on PTG in Japanese. And while I was writing this book, I thought about this and have to question whether the way we interpret the results is correct. Based on the results, second story did not seem to work, and that's how the authors presented too, because the levels of PTG did not keep increasing from the beginning to the end. For my psychoeducational program, I was originally hoping that only people who are in the PTG group showed an increase, but it didn't happen either. But I wonder why we assumed that increase in PTG should be the sign of a positive impact. It's tricky. If we just assess the participants' stress symptoms, such as depression or anxiety, the results are straightforward, because if the therapies are effective, the levels of the symptoms should show a significant decrease from pre to post therapies. But when it comes to PTG, it's different. It's not the same as the recovery from stress. So if program is successful, is PTG supposed to kick in and increase? Or stay the same? Or become actually lower, because perhaps when the trauma is fully integrated, their criteria could even change? For any programs that are intentionally designed around PTG, we need to remember that PTG is a fundamentally different concept, because PTG focuses on irreversible and transformative changes. It should not easily follow a linear progression. This is what I believe was my error, which is not about the actual program, but the way we expect our outcomes and the method we used an assessment tool to evaluate the effectiveness. I really want to figure out how we can better assess the impact of the program in terms of PTG. Speaking of which, I'm going to go to Montana tomorrow because I will attend the PTG Summit that is hosted by the Border Crest Foundation. Their mission includes facilitating PTG research, which includes the program evaluation. So how can I say no? I'm very excited about this trip. Well, as always, thanks for watching, and I will see you after I get back.